Hello, Samantha. Welcome back to the clinic. I am going to be doing your annual skin inspection today. So I have you in for a regular follow-up, just to make sure that everything is looking up to standard. So as with your last exam, I will be inspecting the overall health of the skin, having a look at the skin texture and tone, looking for any areas of concern, whether it be blemishes or abnormal texture, any bumps, bruises, lumps underneath the surface of the skin, any concerning moles. I'll also be examining hair growth of the eyebrows and lashes, and of course having a look at the surrounding hairline area. So we can go ahead and get started. There's not much I need you to do this evening. Just sit back and relax, try to remain still for me as I visualize certain areas of your face. Now, of course, if anything becomes uncomfortable, painful, you are more than welcome to let me know. Otherwise, I will just kind of proceed with the next step of the examination. Okay? Do you have any questions or concerns for me? All right, lovely. So let's go ahead and get started. I'm going to start with a kind of overall visual inspection, just having a look at the health and wellness of the skin. So, starting by shining my pen light over certain areas of the skin, looking at skin tone and texture of this right side cheek. Also visualizing the earlobe, looking for any abnormalities there. So not noting anything upon my initial inspection. I will come back and do a more thorough inspection here in a second. So moving on to the eyelid area, please remain with your eyes closed. I am inspecting the general color, tone, and texture. And the eyebrow as well. And as I come up towards the forehead, I'm looking at the skin itself as well as the hairline area. Now moving to the left half of your face, again looking at the eyebrow as well as the eyelid. No signs of discoloration there as well. Lashes are very, very full. And looking at the cheek on the left side. No signs of discoloration there. So also going to look at the mouth area, looking for any signs of abnormal dryness. Just not notable. Lips do appear well moisturized there. Coming down, having a look at the neck and surrounding areas. Having a look at the clavicle, collarbone area, looking for any signs of distension here, any abnormal swelling, any discoloration, any signs of sun damage. Everything looks okay so far. You see one, looks like a freckle there, as well as on the shoulder. Okay, so I'm going to shine my light from the bottom, and from the top, just looking at the shadow that's cast and the angle, looking for symmetry, which is notable there. Having a closer look at the lashes. Okay. All right. Okay. So initial inspection is seemingly normal. Not seeing anything that looks particularly concerning or different from last year's examination. Now I'm going to follow that up with an up-close inspection, this time using my ophthalmoscope. And this just allows me to have a bit of a closer look at the skin. So I'm going to come closer to you and I will start here on the right side. So just relax for me. I'm just going to visualize, change my magnification as needed. Okay. Very good. Slight manipulation of the skin here as I look. Okay. All right. Just having a look at the ear as well while I'm here. Okay. And on this side as well. No notable abnormalities externally. All right. Good. Okay. All right. So we can go ahead and proceed, Samantha. I am going to do a couple basic measurements for symmetry here. So measuring the width of the forehead, 5 inches there, and directly over the middle nose here, about 10 inches there, and ear to ear we are right at about 10 inches there. So your face is very symmetrical if we part in thirds here. Okay. So just gonna keep your eyes closed for me. You're gonna feel me diagonally here. And about 10 inches there as well. Good. Okay. It's a very symmetrical face, facial features. Okay. Secondary set of measurements here with my calipers. This just allows me to measure more precisely. So measuring for symmetry starting at the brow bone. Good. And measuring the width of the eye in its entirety here. Good, and comparatively the length of the eye versus the length of the nose, which is about even and in line with the mouth as well. Okay. And the whole of your face. Measure for symmetry at the chest wall comparatively to clavicular line and lower third of the face. Okay. All right. going to proceed with a stethoscope inspection, so just bear with me as I place my stethoscope on. Okay, so I'm going to ask that you just breathe normally for me, just normal breaths. Okay, so moving on to the forehead. One last check here. Okay. All right. So no suspicion of anything wrong upon auscultation. Everything did sound normal. So I'm going to go ahead and put my gloves on now. Okay. So let's go ahead and move into some palpation of the face. You're going to feel my hands touching you in various places of your face. If you just relax for me, of course, if there are any areas of tenderness, you should definitely alert me. Starting with a very flat-handed motion. Just going to feel around, palpate with my fingers, feel for anything of particular concern. Just feeling along the cheek. Good. Lower jawline. Feeling along the gum line and the teeth, bone structure, as well as upper jawline. Feeling for any skeletal abnormalities, any signs of misalignment, any swelling or deviation that could indicate an issue with your TMJ. And following that by coming down below the ear, feeling along the mastoid process behind the major bone that lies here at the base of the skull, up towards the fattier portion of your cheek here, feeling for skin texture and integrity. Coming up towards the temporal region, again, flat-handed circular motions, no signs of swelling or edema here. As we come up towards center forehead. Okay, feel along the nasal passages here, feeling for any signs of swelling, soreness, any irritation. Also feeling along the nose, begin up towards the bridge of the nose, going to feel directly along the brow bone. Very gently below the eyes, palpating along the orbital socket. Okay. So I'm also just going to palpate here along the hairline, feeling for any abnormal nodules, any signs of distension, swelling. Any issues with the follicle, which so far is not notable. So I'm also just going to peek inside the hairline itself. I'm not noting anything, I don't see any signs of flakage. No discoloration. Also not noting any signs of hair loss. Hair is very full. Obvious new growth, indicative of a healthy hair growth pattern. Okay, so I'm going to feel along the neckline. Once again, palpating here below the jaw, feeling for any signs of a lymph node distension, anything that could indicate a risk of infection. Just so far not notable. No signs of deviation or misalignment along the throat, so that's a very good sign. And nothing notable at the upper body either. Alright. Moving right along. I am going to assess for the overall skin turgor, skin elasticity. Just making a gentle indentation at the surface of the skin. Watching for reactivity and release. Looking for any signs of delayed responsiveness, which is not notable. Pushing in gently on facial tissue. Again, watching for reactivity. Still maintaining a healthy balance of collagen production here. Very good. Okay. Secondary test for skin integrity is going to involve my Thumbles. So just using my Thumbles to assess for skin texture. The rigidity allows me to just gently pull at the surface of the skin without tugging too harshly. Just enough pressure to hold the skin taut. Very good. So far, no signs of dehydration or lack of moisturization. Skin elasticity appears to be intact. I see normal reactivity here. Do notice some slight congestion at the nose, which could be alleviated with some physical exfoliation or chemical exfoliation. Some slight signs of dehydration here at the mid-brow. Just providing a sense of friction at the hairline, looking for any dislodgement of skin flaking or dryness, any signs of dandruff or psoriasis, none of which is notable here today. Alright. Final test for skin texture. Just have a spatula tool here that allows me to scrape ever so gently at the surface of the skin. Looking for any signs of dislodgement of any foreign particles or any dullness or roughness of the skin. Just running the flat plate over areas of your face. This will allow me to detect any underlying bumps that I may have missed. I'm also going to use the other side of my tool to assess the bony prominences, starting at the brow bone, assessing basic curvature. As well as at the jawline. Okay. Doing some pressurized testing here. This allows me to pump pressurized air onto the skin and watch for normal reactivity. So just testing different areas. So far, not noting anything concerning. Okay. Just going to use my metal tools here to have a look at the health of the eyebrow. Not seeing anything here. No signs of discoloration. No signs of alopecia. Brows are very thick, well groomed, and appear healthy in both texture and fullness. And of course the lashes look great, nice and full, very healthy. No signs of sparsity anywhere, and they are very even. Okay. Just making sure to check areas surrounding the hairline. I'm going to do a bit of reflex testing of the facial muscles here, so just relax, keep your eyes closed for me, just looking for a specific neurological response here. Very good. Very good. Following that up with a bilateral check for response here by placing an identical object on either side of the face. Just looking for that natural reactivity, which does appear to be intact symmetrically. Very good response there. Good, very strong ocular response there. Okay. Alright, Samantha, so I'm going to do a final palpation here. Make sure I didn't miss anything externally. Doing some manipulation of the facial muscles here. Oh, I didn't notice anything abnormal. Skin texture is smooth. No noticeable areas of raised bumps or lumps. Very little congestion. Skin appears fairly well moisturized. Very full lashes and brows. Hairline is very well intact with lots of new growth, which is a good indication of healthy hair growth pattern. I didn't notice any abnormalities of the external ear, as well as the lymph nodes, both mandibular and clavicular, were not palpable, indicating no sign of active infection or issues with immunity. No signs of distension at the shoulder. Upper extremities are aligned. And I would say overall your skin health, facial health, bone structure, and integrity is intact. I appreciate you for keeping up with your annual appointments, and I hope to see you again this time next year. Obviously, should any concerns arise, you are more than welcome to make an appointment prior to your next annual checkup. Otherwise, I will allow you a few minutes and get home safely.
Thank you.
Thank you.